Thank you for joining us for the first in a series of quarterly webcasts hosted by the Vision Impact Institute. In this series, we'll share perspectives from diverse voices committed to ensuring that the world sees better. At the time of our recording, the world marks the one-year anniversary of the initial global lockdowns due to the coronavirus pandemic. Much of life as we knew it has been affected, including our children's education. Today, Judith Williams, the VII Program Manager for the Americas, hosts a conversation with leading individuals who can attest to the impact school disruptions have had on our world's children. This discussion will highlight the impact of some of these school disruptions on children's vision in the US, explore ways to remove barriers to children accessing good vision during this time, and suggest ways to prioritize children's vision, whether learning happens at school, at home, or any other location. In January, in my first vlog of 2021, I highlighted the role that coalitions and partnerships play in expanding awareness and advocacy efforts for good vision around the world. These will remain a heavy focus area for the coming year, and today's discussion is a perfect example of how we can accomplish the goal before us. I hope you will enjoy this conversation and be inspired by the innovative ways these advocates are facing challenges and implementing unique solutions to ensure our children have the best chance at a promising future. Over to you, Judith.
Thank you, Kristen. I'm Judith Williams, Program Manager of the Americas here at the Vision Impact Institute. I lead the advocacy efforts in the US and spend much of my time focused on children's vision. I am honored to be joined today by an accomplished panel of guests, all working on different aspects of children's health and education, and especially focused on the welfare of children. Today, we're joined by Donna Mazyck, Executive Director of the National Association of School Nurses, Becky Palm, President and Executive Director of the Essilor Vision Foundation in the US, Dr. Charles Shidlofsky, Clinical Director of Neuro-Vision Associates of North Texas, and Joe Ricci, Executive Director at the Pennsylvania Optometric Association. A big welcome to all of you. To start, I wanted to get a sense of how COVID-19 and this pandemic has affected the children that you interact with in your roles. In other words, what were you experiencing pre-COVID and how different do things look now? Donna, we'll start with you. What are school nurses telling you is different from them in their work now versus a year ago?
Well, specific to children's vision health, what's very different is that children are not always on site in a school building. They're learning virtually, or they may be in a hybrid program. And so trying to make sure that those students have the health services and prevention services they need has been more of a challenge this year.
Definitely. It's been a challenge for all of us. Charles, I'm assuming you have some parents now that are comfortable bringing their children in and others that are still not comfortable. What's different for you in your practice today?
Well, I think early on that was the case. I mean, there were some people that were really nervous. We have a pretty good amount of people doing vision therapy in our practice. And obviously when we were closed down, what happened, we did a lot of our sessions remotely, which, you know, it can be done, but it's really not nearly as successful as, you know, working one-on-one with the person. And then come early May, we reopened the office. And at first, I mean, putting in all our new procedures, our disinfection procedures, our masking procedures, things of that nature. That was a real challenge. And I work with a lot of children on the autism spectrum, for example. And putting a mask on some of these children with autism was a very, very difficult thing to do. But I think everyone slowly has adapted to this. And really, the truth is that I'm as busy as ever, or if not busier than ever now. that people have adapted, and people are coming in, and we're even seeing more kids than normal. And the reason I think is that's happening, and I'll talk about it a little bit more later, perhaps, is the fact that kids are in front of computers all day long. So I think those are the biggest things that have really changed, and that has been the big game changer in this whole thing, is the amount of up close work they're doing, the amount of computer work they're doing, and it's taxing on the vision system, not only for kids but for adults too. And that goes for the teachers. The teachers are being affected as much as the kids.
Great. Yes, we'll touch on that in a little bit. But that's good to hear that they're coming back and they feel very comfortable bringing their children to have a vision exam. Becky, let's go to you. At the Essilor Vision Foundation, you and your team had to take a break for a while. You couldn't bring the mobile clinics to the schools and do the eye exams that you frequently do because of the school district closings. So how did you have to adapt, and what did you do when you resume? How did you see things were different?
Definitely, COVID was, our 2020 has been a year of adaptation. And as Donna mentioned, a lot of change on the nurse landscape and in schools, depending on how children were learning. And that's certainly one of the aspects when we were able to resume in the fall. We resumed in October. That was a consideration. So one of the first adaptations was, in addition to working through a school-based model, as we expanded it to be including a community clinic-based model, a community-based model, and that it allowed the flexibility with children learning in different environments for us to be able to see them. Flexibility, it also took the burden off of the nurses in some instances, that engagement that's required in order to get consents and get children seen. So that was a big piece for us. We've also shifted the way we operate. We are a little bit looser in the number of days we are operating in clinics to allow flexibility if there are quarantines or other considerations. We put a little bit of a delay behind big holidays in case there's going to be a spike. The way we operate our mobile clinics has evolved, and that in order to incorporate safety protocols, as Dr. Charles mentioned, and some of those new steps in terms of putting on masks, the questions you ask, and the, how close proximity you are with children have been things that we've incorporated. Our mobile clinic not only sees the children, lets them go through an exam, pet out a pair of glasses, but we've also, pre-COVID, we're cutting and edging glasses on site and dispensing same day in order to allow that social distancing. We took that cutting and edging and manufacturing component off of the clinic days. And so we could do the dispensing separately in order to allow that safety component. Also rolled and reached into some of the schools, into gyms and other areas in order to spread out and maintain that distancing. We also took the opportunity while we were suspended to look at and implement quality enhancements that were actually welcomed in general, but also proved to be very helpful in a COVID scenario. That included electronic exam flow, so we could go paperless. Not only does that allow less touching of things that when we were trying to be very safe in terms of those procedures, but also if someone is quarantined or if there's something we need to go back and look at, a really nice flow of information. We've also done online consent form and online scheduling, which has been great as we've gone to the community based model as well, so that you're not having to go through the nurses to get those failed screenings and consents back, but allowing parents and loved ones to do that independently and then come through our clinics all around. In terms of other things that we're seeing, in Texas, we have a mandated, certain school years are required to have screenings. And there was a lot of pressure, again, as Donna mentioned, with the nurses and with other faculty in terms of, are we going to adhere to those mandates when we don't know where the children are? And parents were having the ability to choose every 9 weeks if they wanted their child to be in person or virtual. And so that may have played a part into the state in January lifting the state mandate. And as a result, a prioritization or maybe a different shift in terms of the district's focus on getting us in there for exams. And so again, allowing us to have the flexibility through the community models has been proven to be important as we continue to work with different schools and community environments. I'd also say that we are an active partner and a member in the Mobile Healthcare Association, and they've proven to just share some interesting anecdotes and percentages in terms of not just what we're doing here in Texas, but around the US. And I thought it was telling that you only have about 70% of mobile healthcare providers out there providing vision exams right now, and over 40% of them are not actually doing the mobile vision care space. They're actually helping with COVID testing, helping with circulating vaccines, or even just doing screening. So a lot is shifting, and they are indicating that at least 2/3 of them don't anticipate being back into where they were pre-COVID before 2022, which probably aligns with the vaccines and getting children on board next year. So, Texas, we've been able to make some great headway, albeit in a limited capacity, but there's a lot to be determined in terms of the trajectory and the timing of getting things back into a pre-COVID space.
Yes, definitely a lot of changes, a lot of flexibility to adapt to new things, innovate. I think that's fantastic that you were able to continue and with your team to provide these type of services. Joe, I wanted to go to you. What impact, from your perspective, those POA members of Pennsylvania Optometric Association members with pediatric vision care practices have encountered?
So our members have reported an increase in concerns about children's vision care issues. As the pandemic has required students to receive their educations remotely, their world is being reduced to the 2 to 3 feet between their eyes and their computer screens. And as a result, they are having a prolonged use of their near vision, and that's led to an increase in findings of myopia or nearsightedness. And as the muscles of the eye are required to focus in that near vision, they're losing the ability to quickly adjust to distant vision. And as those muscles weaken and they cause an increase in problems with focusing, as the kids switch from their near vision to their far vision, we're starting to see more complaints and concerns about children adapting out of that near vision world. And as children are faced with these focusing problems, they're facing greater challenges in meeting all of their educational goals. And because most of the students are now working remotely, they're losing access to vital school-based services like vision screenings and other efforts to be able to identify problems as they're starting to develop rather than after they've already established themselves.
It is clear that from what you pointed out, children, parents, and educators are truly feeling the impact from all of your perspectives. It is something that we definitely have encountered. Becky and Charles, we're hearing a lot of news about the increase of eye-related issues during the pandemic. Eye strain and myopia amongst the most common, but also other children's vision conditions for sure. Specifically, I wanted to point out a recent study in China which determined that confinement during COVID-19 induced a significant myopia shift in children ages 6 to 8, this compared to the year before. This possibly is due to the lack of time time spent outdoors and the increased time with the digital devices, as you mentioned. Are you possibly seeing that in the children that you see to a greater extent than before? Charles, have you seen that? And then maybe Becky?
Yeah, we've definitely seen that. I mean, obviously, we did a good amount of myopia management here in my office. And obviously the kids that we're managing are actually doing reasonably well, but the ones that have your general myopic patient, they seem to be progressing at an even faster than normal rate. That's just, obviously we haven't collected all the data on it yet because it's so new, but we're definitely seeing some creeping of myopia that at probably a little bit more advanced rate. The other thing, obviously, that we should talk about is, the fact that these kids are in front of these computer screens for all day long, and they're really not getting outdoors as much as they need to be getting outdoors. And obviously, we know with myopia, There was a new study that just recently came out that showed that children who go outdoors 2 hours or more a day have a much lower rate of progression to myopia. So I think it's really important, and I've stressed to all the parents that have come through here, get your child outdoors some, get them away from the computer screen. Give them a break every 20 to 30 minutes, and make them go outdoors. That doesn't mean go from the computer screen to their cell phones or go play a video game. It means go do something far away. Okay, get back that three-dimensionality in life. Okay, because that's missing largely from that situation. The other thing that I think's really come about because of this is, I think these kids in front of the computer screens all day long. Obviously, there are accommodative issues. The near-far focusing issues have been a real big problem. But the most interesting thing that's really come of this whole thing is that I am seeing more and more patients here because kids are being educated at home, and the parents, for the first time, they're actually seeing that their kids are really having a problem. Okay, they were having a problem before, but now they're actually witnessing it. Okay, and they've become the teacher, and when they witness this problem, I said our phones have been ringing like crazy because parents say my kid can't learn, but they probably couldn't learn last year either or the year before. It's just they're witnessing it now, and that has been the biggest and most interesting thing that's come out of this whole thing.
Obviously, different perspective, but I echo a lot of what Dr. Charles has said. While we don't formally measure or have a baseline for maybe an uptick, as he mentioned, children are spending so much more time at home. I mean, from personal experience, I had a young daughter home with me for 6 months last year, and inevitably just the amount of screen time and, when you're trying to work from home, how much can you take them outside and do those types of things? Those balances were definitely challenged for many, many families last year. I will say, when he talked about the education of trying to make sure that children are outdoors, getting that 3-dimension, trying to combat that one of the things we do at the foundation is make sure we provide information and guidance to parents and loved ones about the importance of getting outside, the 20-20-20 method. In addition to that, this past fall, we put together a nurse information kit for Title I elementary schools in North Texas for those nurses to have information and tips to try and help and educate parents and loved ones, no matter if they were in school, children were in school or virtual, to help, again, manage that, try and identify if they were suffering from eye strain, how to combat that. So a lot of the same things that I think Dr. Charleston touched upon.
Great, thank you, Becky. Joe, are you hearing the same from the eye care providers in your association, or is it something completely different?
No, actually, we're hearing very similar things as Charles and Becky have discussed. The members of our Children's Vision Care Alliance have been very concerned about the need to get children outside, to get them to stop living in that very narrow plane of focus, because they are seeing complications in their vision from that lack of ability to focus both near and far, and gaining that 3-dimensional aspect of the world in which we live. So I think it's very interesting to hear the comments, because we are seeing the same types of things, which suggests to me that there really is a serious problem that really needs our attention.
I'm going to switch gears a little bit to focus on some barriers and access. Now, there have always been barriers when it comes to access to vision care services, but schools have been a great viable access point. Donna, please tell us about any unique new barriers that school nurses might be encountering right now.
Well, schools are indeed a place where most children come through, and School Health Services has provided a safety net. We're hearing from my colleagues, Becky, thank you for putting that list together for school nurses to share with parents, but all of the children at some point through their K through 12 schooling have a routine of getting vision screening. So you capture most of the children. 78% of the states in this country have mandated vision screening. That all goes to the wayside when the children are not physically in person in school. And that's a concern because there is an issue with equity related to that. You know, when Becky talked about Title I schools, those are schools that are specifically provided extra resources because the students who attend that school are living with more vulnerability in many ways, and especially financially. And so it is very important to make sure that we're capturing those students. The barrier is that routine of certain grades being screened is gone. Right now, we've seen school nurses try to overcome that barrier by making sure that they are prioritizing screening for students who already have health concerns, vision concerns, and screening for students who are in special education and may need those extra supports. And also screening for those parents who are making requests, because just as we've heard, parents are seeing for the first time that their children really are having struggles with seeing clearly. And so school nurses are prioritizing that. They've tried to get past that barrier by having appointments for when a parent may want to bring a student in. But the barrier, when there are students meeting in person, the barrier is you can't do screening the way you normally do it because you need to put in the mitigation protocols for COVID-19. So you can't have the large groups. I've heard school nurses who say that they're screening 3 children at a time because that is compatible with having the distances that they need for them to move through. So these barriers are real and they affect student learning.
Definitely, Donna. I can't imagine what the school nurses have to go through this past year with all the new protocols in place and the changes, plus the learning they had to do with COVID-19. And prioritizing vision services is definitely really important. I'm glad that they're doing what they can under the circumstances to make that a priority.
There's one piece I would like to also address that's been a barrier, and Becky spoke to it. Those partners, vision care partners that schools and school nurses and families have been accustomed to, they weren't available. They couldn't come in. And even for screening, those partners who would come in to help with screening were not allowed in because schools were either closed, or if they were open, they wanted to minimize the non-school staff who would be in the school building. So a lot was missed, and that rolled onto what the students have had to go without.
Very good. I want to go to Charles. Charles, as Donna mentioned, many times a vision issue is picked up first in school, in the school setting, either by the nurse or in many cases also by the teacher in the classroom. And then the child ultimately ends up at your practice. How could parents help in detecting early visual needs? You mentioned that parents are now noticing it even more because they're being the teacher, right? So what can they do? How can they notice? How can they pay attention to some possible issues? And how can they add value to the school nurses, the school screenings and teachers, so that when the child gets back to in-person learning, they're not putting additional strain on nurses and teachers?
Well, the visual acuity screening, that is largely done by school nurses, and then when groups like Essilor Vision Foundation or Lions Club come into a facility to help out, they're good for really that patient who we discussed already, the patient who's myopic, getting more myopic, it's going to pick that up. But I also think oftentimes vision screenings are inadequate. And I've lectured to the school nurse groups in the past, and I've said, you know, if you spent an extra 20 seconds more per student and just did eye tracking and convergence, you would really find the bulk of the vision problems that are causing problems in school. I'm talking about higher percentage than just the myopes, okay? Because it's these kids who are having trouble tracking, and these kids who are having trouble converging their eyes. Those are really the kids having trouble in the classroom. And so that the point that I wanted to make today is, let's see if we can add something as simple as that. I know the school nurses are taxed as it is, especially under these circumstances, but it's also, you know, when we closed our office for 6 weeks at the beginning of the pandemic, I called it a reboot, and we rebooted and we rethought how we were going to do things, and we put in new policies and new procedures. This is a great time to reboot and really rethink the whole visual screening process in schools, so we can really identify the kids who are truly having a problem in the classroom. Because as I said, 20 seconds per student more, and you're going to uncover so many more vision problems.
Yes, definitely. School screenings regulations are not the same in every state. It definitely varies. I just saw actually today that Kansas is proposing a new legislation to improve this school screenings. But it's a great point. We definitely need that the children has the appropriate vision screening. Becky, I know that this global health pandemic has also brought an economic pandemic. Everybody has been struggling financially in definitely many sectors. What are some of the things that the Essilor Vision Foundation is doing to ensure that economic hardships are not a barrier to kids being able to see well?
Well, you're absolutely right. What we've seen in terms of the disparity that's taken place because of COVID, and we absolutely know at the foundation that the need is getting greater and greater. And, you know, for us, as we focus on providing vision services and care to the underserved, really trying to identify what ways we can help them when they're already really taking a step back and trying to struggle and maintain in a really, you know, uncertain time. With that, you know, as I previously mentioned, going beyond the traditional school model so that we could reach a broader base by doing the community-based approach has been very beneficial. It allows outreach in a broader way than just through schools. For example, right when we were resuming back in the fall, we did a community-based clinic in the Garland ISD in North Dallas. And there was a post in the news about how we were doing it, and it was community-based, but, you know, and indicating that the children from that school district could participate, you know, community-wide. And we were booked and filled up, you know, really probably within an hour. And it just goes to show that if you can go beyond perhaps just the traditional form, again, with the nurses having a lot of different limitations and trying to juggle, and then even though they may be able to have those restrictions about going on campus and some of the limitations we are just still working with, that has really removed some barriers for groups that would otherwise have some challenges to be seen. Another one is that we've just been really thinking about and working creatively with more partnerships in the community, working with food banks, working with health and welfare service organizations, trying to make sure that we can provide our services to the whole family. We do focus on children, but again, whole families are in need, and making sure that we're looking outside the box and not just in the traditional school setting, but where other places where families that are suffering hardship are going to go to, so that we can find another way to serve them.
That's really great, Becky. Joe, are you hearing from optometrists in your state about barriers that they may be seeing when it comes to children and parents seeking vision care? And maybe not only in Pennsylvania, but have you heard anything in particular?
Yeah, to build a little bit on Charles' comments, I think one of the biggest barriers that our members are seeing is an educational barrier. And what we are finding is that parents don't really truly understand the importance of a comprehensive eye examination. And many people view vision screenings, which are very important, as that comprehensive eye examination when in fact they're not. And there are very solid studies out there that have shown that even using the best available equipment in the best trained hands, 30% of visual problems are missed in your average screening. So as Charles suggests, adding some additional time to do some tracking and convergence studies could have a huge impact in the success of identifying problems that children are having. So what we are seeing is that there really needs to be a much better job to educate parents, teachers, and students about the things to look for to trigger the need for that annual comprehensive eye health examination.
Yes, so true. There is a need for greater awareness and education to parents and the community in general, even legislators, right? To improve and make better regulations. I think, you know, we know that many of the vision disorders that children experience are preventable or treatable. There is actually a very recent study from the Lancet Global Eye Health Commission that says that 90% of these vision problems are preventable or treatable. So definitely really greater awareness and education is needed, and more advocacy efforts as well. Right now, a lot of parents are under a big strain too. Are any of your organizations putting additional plans in place to reassure that what children are experiencing could be normal, or to provide with tools or ways to cope with the situation? Let's go to you, maybe, Charles.
Well, I think, you know, obviously there are some barriers out there, and we really have to kind of figure out ways to kind of communicate better. And that's really where I put my focus, is on communication and really explaining to the parents, this is kind of why your child's going through these problems, and really kind of illustrate it to them in an easy language that they can understand. And as I said, I alluded to earlier, these parents are also having the same vision problems as their kids, because they're working from home. Okay, they're sitting in front of computer screens. I can't tell you how many times I'm talking to a parent about their child, and they said, you know, I've been having these problems too. Okay, so I think you really have to be sympathetic to that and say, well, you know, it's not surprising either, as much time as people are spending in front of their computer screens, that adults would have this problem. So I think that's kind of really where I put my focus. Obviously, I'm not an organization, but a private practice. But I've really put my focus on spending more time, as I've actually lengthened my exam time slots, so I can do more explaining and also do more disinfecting. Same basic thing. But I've been able to spend a little bit more time just within that explanation, so that parents have a greater understanding, and they also know why they're having that problem too.
Donna, how about you? What are the nurses saying about that?
Well, one of the things that nurses are seeing, and it's part of an overall concern, is, and we've heard from our colleagues, that when there was the shutdown in the spring of 2020, some parents, just in accommodating and getting used to the new way in which they were living, had neglected to do annual health exams. And so we've been, from the school nurse standpoint, really trying to get parents back on board with understanding the value of preventive health visits, whether that's getting to the primary healthcare professional's office, their children's pediatrician or nurse practitioner, or whether it's getting the eye exams that they had started or maybe didn't start, but really emphasizing prevention. To your point, Judith, there is so much about eye and vision health that is preventable. And so helping parents understand that has been part of what we've done. We've also provided on our website just information from eye care specialists and prevent blindness, just to be able to give parents a connection with what they could use to help them understand how you have to get back into the prevention line when it comes to care. That's why I was so thrilled, Becky, with what your organization did in giving those tips for parents. In my opinion, wherever parents are, wherever there are the adults who are in charge of children, they do need to have that information, that education, that understanding that the wellness factor matters, whether it's mental health, vision health, or any other kind of health care, that prevention is so important.
So true, very good points there. Definitely also parents don't know and children are not able to tell that they're not seeing well. They can't explain that to a parent, and sometimes the parent doesn't notice until maybe it is too late or is a significant problem. But they're all very good points. I want to talk a little bit more, and we have touched on this, on prioritizing, right, at this time during this pandemic, still prioritizing children's vision. But it's no secret that the health story and priority is and must be eliminating the pandemic right now. But the following questions for each one of you, if you would like to respond. What can we be doing now to ensure that good vision remains a priority for children while still living in this reality of the moment? Most of you mentioned, yes, we have to educate parents. We have to let them know what they can notice, right? But how can we prioritize children's vision?
Sure. The Pennsylvania Optometric Association has a long history of focusing on children's vision issues. We were the creators of the Kids Welcome Here program, which was an educational effort to instruct parents and school personnel about vision issues and the need to have comprehensive eye examinations. We worked with the school nurses in all of the school districts across the Commonwealth to help provide instruction and education how to best serve the students through the screenings that they were doing. Unfortunately, the pandemic got in the way of us getting back out to the school districts last year, but that is certainly on our schedule of things to do once we can get back into the schools. The other thing that we're doing right now is we're working with legislators in the Pennsylvania General Assembly to adopt a comprehensive vision examination requirement so that the screenings that are currently being done are supplemented at particular milestones in a child's development with an actual comprehensive eye examination performed by a doctor of optometry or a doctor of ophthalmology. And it's our hope that through continuing our education efforts and engaging in some legislative work, we will be able to create a better foundation and environment to make sure that young children are not slipping through the cracks, and we are able to provide correction for the many preventable eye diseases that are out there.
Great, thank you. And we partner with you with some of the efforts, and thank you for that. Donna, how about you? And then maybe the rest of you can jump in.
Well, one of the things that is very clear to me is in prioritizing children's vision is to admit that health and learning are linked, and that child's vision is a part of the health that matters in their learning. And so because of the pandemic, this is very, very visible, if I could use that term, for parents, and not just parents, but those babysitters and guardians, childcare professionals who are with children more than they've ever been before. I think it's time to seize that moment and prioritize health in the learning. And by doing that, we're looking at prevention. We're looking at what's needed. I heard a lot today that it's very clear that we have an opportunity. We've heard the adage that what brought us here won't get us there. And this whole concept of rebooting or innovating and making it work for the children. We don't have to guess at what that is. We already know that. I'm hearing today, just 20 more seconds of specific tests to do in vision screening will make a big difference in identifying children who may have vision needs. So I would say that we need to come together as professionals who care about children and make sure that we are providing what they need, the best of what they need, so everyone is reached, not just some. Again, equity in this vision care and prevention.
Absolutely. I think we can all do our part and join efforts to reach better outcomes for our children.
I want to just echo, build off of Donna's comment and say that, there are a lot of competing messages out there right now, but really for us at the foundation, we've just continued to stress to give vision a voice, to make sure and continue to keep it in the dialogue, keep it relevant more than ever, to continue that education and awareness piece, especially because a lot of the ways that they traditionally learn about it are not happening in the typical format. They're not in the classrooms, they're not working with the same people, they're with new audiences. So you're right, not just educating the usual suspects, but expanding that education base out to babysitters, other friends and family or loved ones that may be spending additional time with those that may need additional oversight for their vision care. And as we mentioned, there are a lot of ways that we're doing it at the foundation locally. We did that through the vision kits for the nurses, but also we kicked off last year, coincidentally, and it's really ramped up, a nationwide program called Champions for Sight that's really focused on providing that same type of resource and information to teachers, nurses, administrators, coaches, that then they can push down to parents, loved ones, children, and continue that education model. So for us, we love that, not just because they can have that access to resource, but they can go to our website and easily pull it down at any time and making that accessible. Again, just making vision a part of the health to the education component, as Donna said.
Donna said something really, really important also. I'm going to re-quote you here, Donna. And that you said, admit health and vision health and learning are related. That is something that is way, okay. We know inherently, parents know inherently that good vision and learning are related. Unfortunately, there's been enough stresses from other areas in the eye care world that have denied the fact for many, many years, and these are influential forces, have denied the fact of that existence, that vision and learning are related. But you're right, this is a great opportunity to really push that point and really make this a really a trend for the future here. And I think a good way to do that, if we can make like some public service announcements that really kind of show that would be a kind of, in my mind, me just being forward thinking, I think that would be a wonderful way that we can, whether the Vision Impact Institute, Essilor Vision Foundation, or others, that we can get this word out that these two things are interrelated. That is a really important point.
Yes, thank you, Charles. Definitely, and we have been working on that for many years now, showing the impact of good vision into all the social economic effects that will have. We know that 80% of what our children learn is through their eyes, and if they do not have good vision, there's definitely a possible failure in the classroom. So we would love to work with all of you, keeping these awareness and showing the importance and the impact that good vision has on our society. And the final question for today, because we would like to end on a positive note, we would like to ask, when it comes to all this talk about children's vision and school disruptions because of COVID-19, what is giving you hope? What real life examples are you seeing of people who embody hope for children in this time? Joe, we would like to start with you, and then Donna, Charles, and then Becky.
I really think that it's important for all of us to remember that children's vision issues really affect all of us. And those children who are misdiagnosed as learning disabled when in fact they have a correctable vision problem are getting assigned with labels and being put into IEPs, and they're unnecessarily costing our school systems about $1,600 per student per year. And those students that never get their vision corrected end up entering the job market, and statistics show that they are earning on average 12% less than their peer group. So if we can address these children's vision issues when we identify them early on and are able to correct them, then we end up saving scarce taxpayer resources. We improve the economic outlook for everybody, and focusing on these issues allows everybody to win. And that's where I find hope, that there is a solution in which everybody can win.
Appreciate that, Hope. As I look forward, and I am looking forward, I believe that we're at a time, because of the COVID pandemic, that we can truly admit that health and learning are inextricably linked. You can't separate them. And every single student needs to have the opportunity to be healthy, safe, and available for their learning. And my hope is that we truly see that now, that our vision is clearer, that policymakers and programs and practices will absolutely live into that truth.
Okay, I kind of think about two specific words when I think about what's our capabilities. And the first one is performance, and the second is potential. Okay, I think a lot of, because of all the things that's happened in the pandemic, performance has suffered and potential has suffered. Those are the two things that I think we really need to focus on. But going back into hopefully we're going to get kids back in 6 months and next school year. And I think we kind of have to really focus on those two words, is figuring out a way to enhance performance of our students. And a good way to do that is to be able to understand their vision problems. And then ultimately it's about them reaching their potential. There's so many kids that, as Joe mentioned, have these diagnoses like dyslexia and ADHD and ADD, and many of them have really underlying vision problems. I usually joke that I call the vision problem the 500-pound gorilla sitting on top of the dyslexia or the ADHD, and you got to remove the gorilla. Okay, so this is kind of where I'd love to see the focus moving forward, and I think it's time to get those gorillas down and really move forward.
So I would love to add, for us at the foundation, we were very excited to get back in the community in October. And, obviously we're just excited and thankful and wanting to go and do more. And that optimism existed in the sense that we're like, there are people, we will get to them. We knew the need was there. It was just about connecting the dots. But one specific example that I have loved sharing is that very early on, we had outreach from a neighboring school district, and they had wanted to do a Saturday clinic to try and do screenings and exams for the virtual students. And they had asked us if we would come partner with them. They would do screenings with the nurses on site, and we would provide the exams. They, in some initial vetting, had assumed there'd be about 50 kids on site, which is around how much we can do with our traditional model. And so our team showed up, and just for perspective, this is during early voting for the presidential election. So they show up and there is a line wrapped around the building. And of course they're like, oh, okay, it's an early voting location, no problem. And they quickly realized to their delight that instead of 50 children that showed up that day, there were 500. And, to me, when I get excited every time I think about it, but to me, it really showcases a lot of things, but two in particular. One, parents and loved ones are paying attention. They're paying attention to their children. They're seeing there's a need. And two, despite a lot of different things, especially in the fall, people are concerned. They're concerned so much they're not sending their children to school, but that they will go out in their community and stand in line and get an eye exam for their child. That is very, very telling about the prioritization of vision, associating with their success, and what we can be doing to help, bridge that so they have successful futures. For us, we were able to do a fraction of those children, but it provided us an opportunity to then schedule a dozen more clinics so that we could get all those children seen that, again, in this unique situation we may not have seen. So I love sharing that. And yes, no voting poll, just 500 eager families.
Thank you, Becky. That's fantastic. I just have to say, and I love to hear that we are also hopeful. 2020 for us was a year that was supposed to be splendid for the vision sector. Here at the Vision Impact Institute, we are still hopeful that 2021 and the years to come are prioritized around vision health for our children. At this time, I really would like to allow for any of you, if you want to have any final thoughts or comments, please do so. And then we will conclude our webinar.
I would just like to thank the Vision Impact Institute and Judith for the invitation to participate in this really important discussion. And I'm really pleased to hear from my colleagues on the panel what excites them and things that are motivating them. I think there's a lot of common ground here that we can build upon. And I think we can see some real successes and hopefully realize your dream, Judith, to turn not just 2020 into a year of vision, but the whole decade into a year of vision. So thank you again for the opportunity.
I echo that gratitude for being able to take a moment out of what are full days for all of us and focus on what's important. And what's vitally important is children's eye care and health. And I am grateful that we are hopeful, and I believe it'll make a difference in the lives of the children and adolescents we serve.
Well, a big thank you to all of you for being part of this discussion. We love having the diverse perspectives, and we know that everyone who works with our children appreciates your insight and voices. Thank you from all of us at the Vision Impact Institute, and we'll see you all soon.